3 years ago, Alex had a stroke that affected his sight and his mental health. A year ago, he was given control of the money the NHS spends on him, and he bought, yes, a drum kit, along with the services of an assistant to help him with his medication.
Instead of going for weekly physiotherapy to the hospital, I go for a weekly drum lesson. So I make sure I try and make myself go, and it's always here. It's my multi-gym. So yes, so it's not a frivolous thing, but no, it actually is very functional.
So, is there anything that the 37 patients on this pilot in Northamptonshire couldn't get?
The limit is that they have to have a measurable health outcome that they're going to make progress towards and achieve from that. The only limits to what you can buy is you can't buy anything illegal, you can't buy alcohol, you can't gamble with the money, you can't pay off a debt with it.
GPs like Matthew Davis helped people decide how they should spend their budgets, and many opted for non-traditional treatments from places other than the NHS, relieving pressure on the health service.
We've got people getting older, we've got people with more complex conditions, we've got more we can do for people at the moment. And we need to change the way that we're doing things because the NHS can't cope with this going forward. So the issue around personalisation allows us to work with patients much more effectively.
And that's why the Department of Health has decided to offer the scheme across England from 2014, but only to those suffering from long-term health conditions. It could save around £90 million a year, but the real goal is to make ill people feel better.
It's given me a bit of a purpose in life, rather than just going along, joining the rest of the sheep and joining the queue. I'm trying to do something about it myself.
Please drive to highlighted route.
Okay.
Alex has also bought a sat-nav with his money because problems with his memory meant that he kept getting lost. The issue with the whole idea of personal health budgeting is whether the public think this counts as a treatment rather than just a treat.